Okay, now we've come into the lab to pour up our impressions. First, I go through and there's oftentimes, especially when taking an impression and typing on, there's little interproximal pieces of alginate that are very loose. And those can have a tendency to break off on their own and end up in areas of the impression that you do not want them in. So I go through and in between the teeth in these interproximal areas just gently remove these little flimsy, mobile pieces of alginate with a pair of cotton pliers. And we'll kind of speed through this here and go through and remove in between all the teeth. Because what you don't want is one of those to break off and end up on the surface of the tooth or end up in an area that is a critical area you want to evaluate. And so I just remove them. Sometimes you have to do this on a patient, but patients' tissues are much tighter around the teeth, and so oftentimes it isn't necessary. Blow it out with a little bit of air to make sure all the small pieces are removed. And place it back, surrounded by the moist paper towel to maintain the moisture content. We're going to do the same thing for the lower. Just removing any of those little flimsy pieces of alginate so they don't break off during the pour up. Now, in order to get the correct water content for our microstone, we have these devices in the lab that will titrate the water to the right amount for the stone. And they're pretty self-explanatory to follow. You place the bowl on the scale, you tare the scale so it sets it to 0, place the stone in your vacuum mixer and hit start, and it'll add the correct amount of water for the microstone. You have to select the microstone program for it to place the correct amount of water in it. And that will just add the water, and then you need to place that into the vacuum mixer. What the vacuum mixer does is it removes it under vacuum pressure, so it removes all the air. It mixes the stone so that we have a stone mixture that does not have any air bubbles trapped inside of it. Fairly easy to use. You place it inside the bottom of the vacuum mixer and hit start. The vacuum will turn on. It'll hold the bowl up by suction and then mix the stone. Takes a couple minutes to mix, maybe about a minute or so. Hit stop to release the suction, turn off the vacuum, and then it releases. See the mixture, it's kind of a creamy mixture, but this should be free of any air bubbles because it was mixed under vacuum. Before I take the impression, before I pour the impression, I run a little bit of water under it and shake out any excess water. This moistens the surface and allows the stone to flow in a little bit easier. But you need to make sure you shake all the water out. You don't want any pools of water in the teeth. To pour up the impression, I always start in the posterior aspect and add the stone from one location as much as possible. Place it on the vibrator, and the vibrator will help the stone to move from tooth to tooth to tooth. And I gently work the stone around all the teeth and watch as the stone goes in to make sure I'm not incorporating any air bubbles into my pour up. The last thing you want is to have a really nice impression, and then when you go to pour it up, you include a bunch of air bubbles in your pour up and makes the cast unusable. So pouring it up, on the vibrator, systematically moving the stone around to make sure that it fills in all the teeth. Fill in all the teeth first, and once that's completely done, then you can add a little bit quicker the rest of the pour up, but still you want to make sure you incorporate as little air bubbles as possible. The vibrator really helps to allow the stone to move and to form into the areas that you're trying to put it into. So make sure when you do your pour up, it's done over the vibrating unit. When you're done filling up the entire tray, you want to cover all of the anatomy that you captured in your impression. We want to put dollops or little stone mounds on top of the impression. These are going to help to maintain the base when we base out our casts. So you'll see I'll put some small round domes, or some dollops is what they're called, on top of the impression. I usually put 3 on the maxillary and 4 on the mandibular. And these are going to create mechanical undercuts for the second stage of the pour up to get stuck in, so it will adhere very well to the stone. And then we let that set for until it's completely set. It'll heat up, and you want it to set until it's completely cool. We did the same process for the mandibular and place dollops on that one. When you're finished, make sure you clean out your mixing bowls, and it's easiest to do. In fact, it's critical to do when it hasn't set. When it's still wet, it'll clean out much easier. If you let it set completely, it is a nightmare to clean out. So make sure you clean those out before the stone is set completely, before it's set at all. Clean out the sink and wipe everything up. Make sure the lab stays nice and clean. On the wall, Dr. McCraley has gone through and made some instructional posters. If you need any additional information or forget how to do certain steps, you can refer to the posters on the wall.